We would like to demonstrate the proper technique for proning a patient. Typically this is done in ICU.
Okay. So before you prone, there are a few resources that you can access if you've never proned before. If you go to the inside net and go to the proning toolkit, you will find a variety of resources. There is a PowerPoint presentation. There is also a checklist available for you that will help you gather everything that you need in order to do the prone in one time shot kind of thing, rather than having to keep going back and getting your supplies. So the checklist is quite helpful. So obviously, first thing that you're going to need to have is a lot of staff. You need at least 6 people to try to do this safely. I know that might be difficult in some of the other areas, so you may need to talk to your PCC manager or educators about how you can utilize resources within your facility. The other important piece of equipment that you are going to also need is a Pronation Pillow. These are available through your ERECs. You will notice on this Pronation Pillow that there is a slot pre-cut for the endotracheal tube. With a proned patient, you do need to move the head every 2 hours, like you would position any patient in the ICU every 2 hours. So you will need to make another slit on the other side to fit the endotracheal tube. So a few things to remember: when the patient is on the bed, we should have a flannel completely opened up to its fullest on the bottom. Before we put a top sheet on top of the patient, there are several things that we need to consider. First, we need to ensure that eye care and mouth care, dressing changes, and drains have all been done prior to placing the patient in a prone position. Typically, a patient is prone for 16 hours and then placed supine for 8, so you want to ensure that that patient care has been completed prior to proning the patient. The other thing that you need to really be cautious and considerate of is where all your lines are being placed. Most ICU patients, you're going to have a Foley catheter, you'll have an art line. Typically we have a central line, 3 lumens, you have multiple IVs, plus you have an endotracheal tube. So you need to understand which way these are running, and with the RT, determine which way that they want to turn the patient so that they can manipulate the head, ensure that the lines are going to stay secure and in place, and help you position the patient. Once you have everybody assembled in the room, we want to make sure that we have our supports on the patient before we prone. A couple of considerations. With the Foley catheter, we want to make sure that this is actually padded, so you might need to take some gauze, especially when you're thinking about our male patients. We don't want them to get a pressure sore on their private area, and with women as well, you just want to make sure that this is to the side, and that if you need to put any gauze underneath any of the hard connectors, that's also been done. We want to protect the bony prominences. As I said, they're going to be prone for 16 hours, so we want to ensure that we are decreasing the chances of them developing a pressure sore. So pillow number 1 should go across the breast and protect the shoulders. Pillow number 2 should go across the groin to protect the hips. And pillow number 3 should go across the knees to protect the knees. Once you have your pillows in place, you are then going to take your second flannel, your top flannel, opened completely, and you're going to pull it completely up just to underneath the chin of that patient. And you want to make sure that, again, everything is nice and tight and wrinkle-free, because this is going to be the flannel that the patient is laying on once they are proned. As well, you want to make sure that you have your pronation pillow lined up. Eyes go in this section, mouth goes here. If you try to inverse it, then you have the ET tube channel too high, and the eyes actually end up on top of here. And you want to be careful about that, because the eyes do develop a pressure ulcer. So please make sure that your pillow is this way. Now that we have the top sheet on top of the patient, we have our pillows in place, we're going to show you how to do the burrito method for proning your patient. Using the bottom sheet and the top sheet together, you and your partners are going to roll towards the patient, and you want to make sure that as you roll, you're as tight to the patient as you can possibly get to ensure safety of the roll and ergonomics of the staff. Once we have rolled up towards the patient, we need to ensure that the person at the head of the bed, which is typically the RT, if you're in an area where you don't have the RT readily available, you can use one of your nurses, PCC's educators to help you with this. The reason why we need to make sure that the RT is prepared, or the person at the head of the bed is prepared, is that they have to secure all of the lines. It's the highest risk on the patient of them accidentally becoming extubated or pulling out a central line, which is not what you want when you have a patient who is under the ARDSNet protocol. Okay. All right. Joanne, are you ready?
Ready.
Okay. So when we prone, we want to do this in a slow, safe manner. So the first step is we're going to pull the patient towards one edge of the bed, which has been determined by the person at the head of the bed, which is easiest based on line, placement, and your endotracheal tube. We've decided that we are going to move towards the patient's left side. So on the count of 3, we're going to pull the patient as close to the edge of the bed as we possibly can. Ready? 1, 2, 3. Now, the next part is done in kind of a 1-2 succession, but it should still be done in a controlled manner. You don't want to pull and flip too fast, as you may dislodge your lines. So the second part of this is we are going to pull towards the patient's left, even further off the end of the bed, and then we're going to lift the patient up onto their side. Once we lift the patient up onto their side, the staff on the other end of the bed are going to grab our roll, and we're going to grab the roll underneath. Okay, is everyone ready?
Ready.
Ready. All right, 1, 2, 3, pull, lift. Does everybody have a good handle on that? We are now going to go underneath the patient and grab our roll. Okay, and you want to make sure too, don't forget the patient has a Foley catheter. You want to make sure that you're not grabbing the Foley catheter and that everything is in place. What do we need to do? Everybody got your roll? Okay. And then on the count of 3, we're going to pull and put the patient into a prone position. 1, 2, 3. So again, we want to make sure that the patient, we're going to unroll our sheets, and we're going to take this top sheet off. We want to make sure that the patient's in a good position so we can see that our pillows have stayed. So at the head of the bed, the RT or the nurse who you happen to have here should be supporting the head and securing the lines. Now what we want to do is we're going to turn her head and we're going to place the pillow underneath, ensuring that our ET tube is into the channel of our proning pillow. So Joanne is going to be holding the head. Sybil is going to carefully push the pillow underneath the patient, and we're going to turn her head to this way. As you can see, it's not easy, and you do have to do a bit of a squish. This is not an easy thing to do. The head's quite heavy. And again, you always want to make sure that you're keeping cognizant of your lines. Which way are they going? When the patient's head is here, you want to make sure that they are turned enough, because you don't want to put any pressure on her orbits around here. And you want to make sure that the fluffy part of this pillow is supporting her cheeks and that her mouth is resting comfortably with the tube here, because you do not want to create a pressure sore on her lips.
We wanted to step away and have a look at arm position while the patients are proned. So we can do 2 different arm positions. We can do cactus, where arms are up like this, or we can do swimmer's position, where we would go to the side like this, and so the face is towards the arm that's up. Just depends on the patient's size, which option you choose. So for swimmer's position, we usually use that on patients that are of average size. So Karen is of average size here, so we'll just demonstrate what that looks like. So we're going to take the arm of the patient and put the hand so it's kind of level to the face. And we want to make sure that the elbow is below the axilla. And the reason that we want to do that is because there's a brachial plexus nerve that runs down here. We don't want the elbow to be above the axilla, because that's where we can cause the circulation to the brachial plexus nerve to cut off, and we can cause damage. So we need to make sure that the elbow is below the axilla. And in swimmer's position, the other arm just runs along the side of the body with the hand up. And then with all of our prone patients, with all of our ICU patients, but especially the prone patients, we want to turn them every 2 hours because this can be really uncomfortable to lie in. So just thinking about comfort, one other thing that we can do is make sure that so the patient has got her arm up on the side there. We can also move the leg so that it is turned out just slightly, and we have another pillow here that we can put in. As well, we can pull the pillow slightly this way just to make sure that the patient's hip is elevated, because then that will be a lot more comfortable than if her hips are just flat. And one more position for arms that we can do is the cactus position. So essentially what that is just that both arms are like this. So I'll take the pillow out here and turn her hips just slightly. So we're flat and leg will be straight again. And this arm is up, and we want to also make sure that this arm is turned up as well. So there we go. And again, the elbow is below the axilla. And this is cactus position. So you can always keep the patient in cactus position, or you could always keep them in swimmer's position, changing every 2 hours, or you could switch between the positions, depending on how comfortable the patient looks. One thing that we need to consider with our larger patients, sometimes they're much larger than the bed. And so if we have arms up like this, they won't fit on the bed. And so to make the patient a little bit more comfortable, we can pretend that Karen is much larger than the size of the bed here, but we will just extend the arm here. And so you can use bedside tables on either side to just give them a little bit more room. One thing that we need to keep in mind is that if patients are quite a bit larger and we have them in the cactus position, sometimes they'll require an extra pillow underneath their chest, because if they're too flat, the arm will end up kind of going up like this, and that will cause some injury to the shoulder as well. So have a look at what your patient looks like, and if you think they need to be brought up a little bit, you can just slip another pillow underneath the patient. One thing I want to point out is, for the purpose of the video, we have a gown on Karen, but for prone patients, we try to remove the gown because any clothing or cloth could lead to pressure injuries if there's wrinkles in it. And so we want to eliminate that possibility because they're already at higher risk for pressure injury. And so we would just remove the gown from them and then just put a sheet over the top of them to keep them covered.
Once our patient is in the prone position, this is an excellent time to do your assessment for your posterior chest sounds. You can check for any pressure ulcers, any sores, and you can do your posterior assessment. Once you've done your assessment, then you can now cover your patient up with a nice new clean flannel. You've checked all of your lines. And then when you're going to get ready to move that patient into a supine position, you can change your top flannel, put that on top, and then when you turn them back over, they're on a nice clean sheet. A couple of things just to go over before we turn again. Just make sure you have the people necessary, you've done all the skincare that you need to do. Please make sure that you have given your patient sedation or analgesia prior to proning. And if needed, depending on how ventilator tolerant they are, they may also need to have a paralytic. So please make sure that that is all done prior to starting your prone. If you have any questions on how to prone, again, you can access the proning toolkit on the Inside Net, or please talk to your educator or PCC.